And I told him in Punjabi and he didn't really understand, but I said, well, just know it's non-aggressive. So it probably didn't spread, anywhere I did anything crazy. But I had to actually research myself too. I had to look it up. And then the provider came in later that day to tell us more information. And that experience really showed me the strength of pathology in bringing comfort and understanding to families during their most vulnerable times. I want to serve other patients through that same compassion and purpose as a diagnostician helps provide answers when they matter most. And this is what really shaped my interest in wanting to be a pathologist.
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology, one story at a time, and connect with the people behind the diagnosis. Today's guest is medical student and fellow podcaster, Taranjit Kaur. Her path to pathology includes a deeply personal moment that showed her the power of pathology to bring clarity and comfort during uncertain times. Now, she's a post-junior fellow, essentially living a preview year of pathology residency, and we'll hear all about that. We'll also talk about her podcast, Grossly Speaking, how it started, and what she's learned from her guests. Now, here's Taranjit Kaur. Let's start with your backstory, because I don't think you've really gotten into that too much on your podcast. So I want to get it here. So let's start with, what was your inspiration to become a doctor?
So thank you so much, Dennis, for having me. It's really nice that we each have a podcast to get together. My inspiration to become a doctor was actually when I was in middle school. My mom was often really sick, and since she didn't speak much English, I would go with her to doctor's appointments and help her translate from English to Punjabi. I remember trying my very best when I was in middle school to understand what the doctors were saying. I'd write down the medical terms, I looked them up later, and I'd basically explain it to my mom because I wanted to see her get better. And over time, I realized that I really love learning what those terms meant. And every time I looked one thing up, I looked up another and so forth. And this is when my curiosity and love for science and medicine started. I remember telling myself in seventh grade that I want to help others, like the doctors helped my mom. And that's where my inspiration to becoming a doctor started. It was at a very young age, and it's only been growing stronger since.
Was it always going to be medical school, like doctor for you, or not any other kind of healthcare field?
Yeah, it was gonna be a doctor because I had been around them so many times
Mm.
that I loved what they did and how they generated a diagnosis, found a treatment plan for my mom, and being in that room with them, with my mom, I set a goal for myself. I was like, I want to do that when I grow up. That's what motivated me to give it my best for all of my science classes and get good grades.
A lot of the people that have come on this podcast, and probably yours too, they have kind of a personal story that guides them into medicine and guides them into pathology. And it sounds like you have the same kind of thing.
Yeah. It's a really, memorable experience for me to see my mom in that position and to see what the doctors did for her. It was so inspiring, and I
Oh,
would, talk to them, ask them, "Oh, what does that word mean? Oh, 1 second, let me translate that to my mom right now." I was so engaged, and I liked seeing my mom get better, and I liked seeing how they would stay in touch with her care and how they would help her ultimately get better.
okay. That's interesting. All right. So let's talk about you going into medical school. Did you have a specialty in mind as you went in?
I actually kept an open mind. I wanted to explore every topic I possibly could and just see what I loved the most. Because I knew that I wanted to do medicine. I knew I wanted to be a doctor from an early age, but I didn't really narrow myself down. I said, I'm going to keep an open mind, learn as much as I can, and whatever I like, I'm just going to go for that.
Okay. And then, so when did pathology into the picture? Like, what was your first experience with that?
So my very first experience of actually even knowing what a pathologist was in undergrad at UCLA. I was a care extender volunteer at the hospital at UCLA, and I got the wonderful opportunity to be on a surgery rotation where I actually bumped into my PI, who his name is Dr. Quentin Gopin. He's a head and neck surgeon who I've been doing research with since 2017. So I saw him at the surgery rotation and I was like, hey, can I join you tomorrow at 5 or 6 a.m. to watch you do a head and neck surgery? And he was like, yeah, come on in. And so the rotation receptionist, they got me my scrubs, got everything I needed, and then I showed up to the surgery. And this is when I was watching Dr. Gopin collect samples from the outer ear. And he was talking to someone on the speaker, and this is when I like, on the speaker phone, and this is when I was like, "Oh, what is that? Like, who's there?" And he was submitting these pieces for frozen to identify if the margins were clear, if there was any cancer left. And hearing the pathologist talk to Dr. Gopin and say that, "Hey, yeah, like, the margins are clear or negative," it was really interesting to me because it showed that there's this whole other world behind the scenes in medicine, and that diagnostic side is what really can help guide clinical decisions. So this is when I first learned what pathology was essentially. I was definitely intrigued by pathology at that time, but like I said, I still wanted to keep an open mind. I wanted to go to medical school and explore different fields. So that was my very first encounter.
That's interesting. I mean, you had experience with or knew what pathology was before you even got into medical school, which, in
Yes.
undergrad, which I can, looking back for me, of course, it was probably a much longer time ago. I had no idea what pathology was in undergrad for sure.
Yeah, and people still think it's not a part of medical school. It is
Yeah.
kind of, it does take some, like, what is it called? Like, people have to hear about it quite a bit to know, "Oh, yeah, that's medical or that's a specialty."
Yeah. Yeah. Okay. So then, at what point did you decide pathology was what you wanted to do?
It was actually last summer in 2024 is realized when I was pathology bound, and this is, like, my true passion and dream. So what happened was my dad had a large retroperitoneal mass
Oh.
on his left side, like, in his abdomen, and it was going from the left psoas muscle all the way up to the left inferior pole of the kidney, and he was rushed to the ED because of some severe constipation. My family and I, we were so worried. We were really confused what was going on, and because of my dad's severe claustrophobia and anxiety, the physicians couldn't do, like, a closed MRI on him to determine exactly what that mass was. So he underwent a quick biopsy under sedation, and we relied entirely on pathology for answers. I remember the clinical team was like, "Well, let's just wait for pathology, let's see what they say." And I think it was like a Thursday or Friday. So we were waiting up until Monday. And
Mhm.
my gosh, that time took forever. And we were so anxious. We were worried. We were like, is it terminal? Is it poorly differentiated? Is it metastasized? And so my family and I, we just kept refreshing the my chart, anxiously waiting,
Yeah.
counting every second until we heard that like ding sound on Monday. I think it was like afternoon. And I ran to the phone. I clicked the report. We opened it up, and, like, as a translator, I quickly said, "Okay, it's non-aggressive, dad. It's well differentiated." And I told him in Punjabi, and he didn't really understand, but I said, "Well, just know it's non-aggressive, so it probably didn't spread, anywhere I did anything crazy." But I had to actually research myself too. I had to look it up. And then the provider came in later that day to tell us more information. And that experience really showed me the strength of pathology in bringing comfort and understanding to families during their most vulnerable times. I want to serve other patients through that same compassion and purpose as a diagnostician who helps provide answers when they matter most. And this is what really shaped my interest in wanting to be a pathologist. It was all from last summer.
Okay. And again, another personal story, family story for you that's shaping your career path.
Yeah.
You mentioned a couple of times you're translating from English to Punjabi or back.
Yeah.
Have you ever worked as a translator in like an official capacity?
No, I did have a call center job though, like on the phone for like a appliance repair company when I was in high school to support my family, but I didn't really do any sort of translation like that.
I ask that just because I've talked with a few people who are they're pathologists and they're meeting with patients now. That you've heard of these pathology clinics, right? And
Yeah.
so that's interesting enough, but also sometimes having to translate their reports or what they're telling them into different languages. So I thought maybe
Yes.
there's kind of opportunity there for you as
Yeah,
well.
what's really Yeah, it was difficult at a young age, to be honest, because it's like I'm first I'm translating from one language to another, right? But then it's that extra layer of medical terminology that I hadn't heard,
Mhm.
that I didn't know. So having to do research, Google was my favorite website. I'd look everything up. I tell my mom, okay, this is what that is. If she didn't understand it, I'd find another word to explain it better. I really wanted to make sure that I could like convey what one person said to another, and I love doing that even until today. For example, like last summer, how I helped translate for my dad.
Yeah.
And just that whole moment, it was just so powerful to see how that one report can really change a family's life, and especially when they're really vulnerable. And I want to be there for patients when they need it most in situations like that.
Yeah, I totally agree. I had a similar experience with my mom a little over 2 years ago, having to translate the
Yeah.
pathology report and kind of the radiology report too for her. So I can
Yeah.
kind of relate to what you're talking about.
Yeah, and sometimes what happens is those reports get sent first
Yeah.
before the provider says, which isn't the provider's fault. It's just they're so busy, reports are coming in, they're just being sent, delivered to the patient. So I'm just really glad I was there for my dad when that little message notification came on. I'm happy to be there for him and I want to be there for others too in the future.
Yeah. Yeah. That makes sense to me. Now, you're currently doing a post junior fellowship in pathology at
Yes.
UCLA, right?
Yes.
Okay. I want to get into this and what your experiences are with this. But before we do, for anybody who's listening who might not understand, what does this mean? What is a post junior fellowship?
Yeah, so it's like a dedicated year between either your second or third year or third or fourth year in medical school where you take extra time to do fellowship. And instead of like simply shadowing, at least the program where I'm at, we're given like real responsibilities. We grow specimens, we order special stains, we review slides as if they're our own, and we have our own desks near the first year residents. We work
Oh,
independently through our cases, form diagnoses, and then we discuss them during sign out. The expectations are the same as PGY1, so whatever they're expected to do, we have the same. And it was a really quick transition from medical school to residency in a way, but I'm really thankful for this type of training. I get exposed to so much, and I did this because I really wanted to immerse myself into pathology, to understand the day-to-day practice, strengthen my foundation, and discover like which subspecialty I want to specialize in or which one do I resonate the most with.
oh, okay. That makes sense. Where I work with residents, and I've mentioned this on the podcast a
Yeah.
lot of times before, and it seems like that you're talking about like which subspecialties might you be interested in. It seems like they have to decide that as far as like fellowships and things pretty early on. So
Yeah.
you've got almost an advantage, I guess, because you have some experience in these before you even start residency. Is that
Yeah,
kind of the
yeah, that's
point?
what I really like. Yeah, that's what I really like about the program is we rotate through so many different like rotations and we get to see clinical pathology, anatomical, we get to see everything. And then we have to know by our second year of residency actually what we want to specialize in. So having this program, I'm really thankful for all of these wonderful educational opportunities I have.
Sure, sure. How did you actually find out about the program in the first place?
So I actually heard about the fellowship the same way I met you, Dennis, on LinkedIn.
Oh,
I had
okay.
messaged a pathologist, like this was random, completely random. I messaged a pathologist and just asked him, like, hey, doctor, are there any pathology opportunities? And he was like, well, I don't have any, but you could do a UCLA post junior program. And I was like, well, what is that? And then, he explained to me. And to me, it was basically like someone asking me, do you want to spend 12 months doing what you love, rotating through pathology? And it was an immediate yes from my side. So I immediately applied to the program. I reached out for resources, asked prior post junior fellows like how their experience was. And it also worked out perfectly because I grew up in Southern California. I went to UCLA for undergrad. My family's close by. And the environment here at UCLA has been so supportive and positive. There's incredible mentorship, diverse case exposure, and it's been a perfect place for me to learn and grow.
Nice, nice. Are there other, I guess, fellows besides you, or are you the only one?
Yes, there is another post junior fellow, and she's actually from UCLA Medical School.
Okay, okay. And then I always wonder about this. Like you're there with the other residents, especially like the first year residents. How are they receptive to you being there? Like, are you part of the group?
Yeah, they're actually all really sweet and they give us great pointers. We work together, we split the cases. If there's
Nice.
like 10 flats of cases, we say, okay, 5 for you, 5 for me, let's do it. We do autopsies together. Afterwards, we grab food and it's really like a teamwork, like you got this, I got this, we're here for each other. So I really like that.
That has to be interesting too, because I mean, not only are you getting the hands-on experience in the different subspecialties, but you're learning what, from the people actually in it, what residency is really like. So that's got to be useful
Definitely.
too.
Yes.
Now, one of the things about this that I really wanted to dig into, and you've been telling me some of these experiences. So, as you know, I'm a pathologist assistant, and you're
Yes.
doing grossing during this fellowship, which is super interesting to me. So, tell me about this experience so far. What has it been like?
It is wonderful. I actually love grossing. It's one of my favorite parts of the fellowship. So far, I've had a chance to gross in 3 rotations: GYN, or known as women's health,
Yeah.
GI, and most recently, bone and soft tissue. I'm actually currently on autopsy, and I would say, like, that's grossing, but, like, times 100 because you gross, like, everything.
Yeah.
And so
Sounds
I
right.
like how I had those mini gross not mini, but, like, I had those, like, gross rotations that were specialized, so now I could, like, gross everything now in the body. Obviously, we have help, the techs are there, there's another resident, but I enjoy grossing, and each rotation has been so different. I really enjoyed the hands-on aspect, especially using the bone saw, for example, to create, like, full thickness slices and noticing how metastatic disease appears grossly. Like, I can instantly see, okay, that bone right there is kind of soft and yellow, it looks a little suspicious. And I instantly write it on the report, and that really helps me later on when I look at the slides. But I think that grossing is so important. It's so important to be good at it because it's basically it sets the foundation for the entire case.
Yeah. 100% agree. That's what I try to pass on to our residents too. I mean, all of us. We have 5 pathologist assistants where we all
Yeah.
have a hand in teaching the residents, and that's the attitude that we try to portray to them. Is a grossing is, like you said, it's the foundation for everything.
Yeah, exactly, and I've learned better skills through help with the pathologist assistants. They're so kind. There's, like, about, I think, 3 to 5 of them, and whenever I need help, I'm never afraid to ask them. They always help me, like, "Okay, this is how you're gonna orient yourself. This is how you're gonna describe it," and it's a great teamwork we have in there to get through the cases.
Can you tell me whatever's been like some of the most interesting cases that you've been able to gross?
Yeah, I think one of them for sure is the osteosarcoma case. It was
Oh, wow.
interesting to see, like, how sarcomas are like. I haven't had a chance to gross, like, a liposarcoma case yet, but the osteosarcoma case, I could see, like, the soft component of the, I guess, mass, the hard component of the mass, and I could see how it was extending into the diaphysis, and getting to see that grossly was really interesting. It was like a resection, so they were able to remove it all. The margins were negative during frozen.
Mhm.
So I essentially had the full tumor in my hand, like in the femur. And so seeing that was really interesting and getting the sections for that. And then afterwards, seeing it on the microscope. I know I've been mentioning a lot of bone and soft tissue, so maybe you're wondering, hey, that's probably what she's going to specialize in. But I still am keeping an open
Okay.
mind.
Okay. That's interesting. Like, d- is there a point like so far or where you're grossing a specimen and you're like, I can't believe I'm actually holding this thing in my hands. You know
Oh,
what I mean?
yeah, I've thought about that so many times. It For the osteosarcoma
Hmm.
case, that was, like, that feeling. Placentas, I know that, like, we probably get placentas every day, but seeing that, it's like that came from a mom that is, probably has preeclampsia, and what I see is going to help the patient and her baby, so having that is such a privilege to be able to gross these specimens.
Yeah. Yeah. Okay. I love that.
What has been your favorite thing to gross that has made you feel also so privileged to be able to do such a thing?
It's funny. You mentioned placentas just now, and that's what it is. My previous job, which was almost 8 years ago now, but it was a rather large baby hospital, right? There are a lot of
Um,
births there, but also a lot of, not so good outcomes, I guess. And so we had fetal autopsies as well. And
right.
then every 2 months, they would have the perinatal M&M conference. And so all of some pathology, we would go, and then they would talk about these cases, and they would show the pictures that we took while we were grossing the placenta, while we were doing the autopsy, like that. And they would talk about the findings, the things that we found. And I thought, these are the pictures that I took and the things that I saw or that I found or whatever. And I started to realize how much of an impact that was having, not only on that particular case, but future patients, right?
Right.
And not only babies, but the parents too. That really had an impact on me. And I still remember that, to this day.
Yeah. Yeah, even telling the gender of their baby
Yeah.
is really helpful for them just to it's obviously really sad, but they get some sort of closure, they get some idea of like, "Oh, that was a boy or that was a girl," and when it comes to grossing, I think that, like you mentioned, photos, like taking clear photos, making good measurements, documenting everything you see thoroughly, it really helps the patients, the mothers, the fathers, and just by being there for them and generating that report because they read every single word from that report and it means the world to them.
Hmm. Yeah, totally. Totally. All right. Now, aside from grossing, what other subspecialties have you experienced so far during your
I've
fellowship?
Yeah, so I've been on bone marrow, GYN, cytology, micro, breast, GI, BST, of course, and I'm
Right.
currently on autopsy.
Wow. Okay. So out of those, I know we've talked a lot about the bone and soft tissue, but any of the others kind of stand out a little bit too?
Yeah, so I'm still keeping a really open mind.
Okay.
I have to say, though, bone marrow is really interesting.
Really? Why is that?
Yeah. So for bone marrow or hematology pathology, I like how there are multiple studies that go into one single diagnosis. There's like fish studies,
Yeah.
ancillary studies, and then there's like the peripheral bone count and core biopsies. And just having everything come together into one diagnosis, it's like a really fun puzzle. And it's more reassuring and comforting to know that all that is going into one diagnosis.
I've heard people describe it, people that went into hematopathology, especially that it's like the intersection of anatomic pathology and clinical pathology. Right. Yeah.
Exactly. That's exactly what it is. In order to be a heme pathologist, you have to have APCP.
Hmm.
You have to have both. Like if someone wanted to do like transfusion medicine, they could do 3 years CP. Or neuropath, they could do AP, but heme path, you need both. So yeah, it's like in the middle.
Okay. Yeah. I think
Yeah.
for a lot of people, that's the draw too.
Yeah.
It's certainly more challenging, I think.
I find it really fun. For me, I
Okay.
think challenging wise, I think it's probably going to be neuropath. I've heard from a lot of people so much neuroanatomy, so I'll rotate in that neuropath towards the end of the year. I still have like specialties like derm, molecular, transfusion medicine to go through. Maybe I will like those too, but so far I think those stand out to me. Yeah.
Okay. Okay. And then how many months do you have left in this fellowship?
I have until May
Okay. So
next year.
quite a bit of time yet. All right.
Yes.
Interesting. Okay. And I certainly look forward to hearing the updates as you go along the rest of the way.
Yes, of course. I Who knows if I'll change, but I mean, I'm not set in stone with any specialty yet. If it has the word bone in it, I probably would like.
Okay. I think it's really cool that all of the stories that you tell either here or, that you've told me before, you're always very excited about this stuff. And I think that's great. That's certainly a sign that you're in the right place.
Yes, it's so fun. I was actually using the bone saw too much that the PA had to tell me, "Wait, we have other specimen too. We don't just have hips and knees." And I said, "Okay, yeah, wrapping this one up." And then I went to the soft tissue biopsies. But I was standing by that the bone saw machine for quite a bit.
Yeah, no, we have one of those too. I can understand that. They're kind of fun. You're listening to the People of Pathology podcast with our guest, Taranjit Kaur. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know. It's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time-consuming. That's a problem because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first-of-its-kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using short-wave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104-patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstage 4% of patients from N0 to N1. I personally contributed to this study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to PathA, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. Now for the rest of my conversation with Taranjit Kaur on the People of Pathology podcast. So as we mentioned at the beginning, you also host a podcast. It's called Grossly Speaking, which I think I've told you
Yes.
before. I love that title, and I'm jealous that I didn't think of it myself. How did the idea come up to do a podcast?
Yeah, so basically, so when I was in Mississippi, there were like some limited opportunities to find a pathologist to do a rotation with in the Gulf Coast. One of the pathologists who was there, Dr. Nelson, who was on a prior episode, he had moved to Florida. So I actually took the initiative to reach out to the Air Force as a civilian. I
Oh,
contacted Dr. Houston, he's at Keesler Air Force Base, and found him on LinkedIn. There we go, LinkedIn again. So I messaged him on LinkedIn and I said, "Hey, Dr. Houston, can I please do a rotation with you?" And he set me up with all my paperwork as a civilian to do a rotation for 4 weeks. And I was super surprised that it worked because I thought I would have to be part of like the military.
yeah.
Um, but, he advocated for me, got my paperwork set up, and it was 4 pathologists to me, 1 student. So I was so thankful that I could, like, get exposed to pathology since this was my first rotation. And since he's a generalist, I got to see everything, so it was so exciting. And so how I came up with the podcast idea was at the end of my rotation, I was so sad because I wanted to stay there obviously forever. And
Yeah.
I told my partner Rohit, I said, "Hey, I'm really sad. I have to go to the next rotation, no more pathology." And he was like, "Well, why don't you keep it alive by talking about it, by doing like a podcast?" And that's when I was like, "Wait, that's like a great idea. Who says that I have to say bye to pathology right now? I can keep the pathology passion alive by doing a podcast." And so I came up with the idea, grossly speaking. It just honestly popped to me one day, and I was so excited. And then Rohit kind of suggested like a pop of color kind of fits my personality and it would be unique. And so I found like this bright orange burning tomato color
Yeah.
and I loved it and I set it for the entire theme. And then I was like, wait, I need to check if other podcasts have that title or that color because I didn't want to like copy or have the same thing.
Mm.
I double checked and I was like, okay, I'm good to go. So then I created the podcast. And then my best friend, Harnoor Galani, she's also interested in pathology, actually applying this year. I asked her, I was like, "Hey, why don't you join me?" And then she became a co-founder. So that's kind of how I got started.
Okay, I can relate to a lot of that. It's just this interest in talking more about pathology, which was the same for me. And then having someone who kind of nudged you along, like you could do this, and I remember for me, like this was completely out of character for me to do something like this. And it was a friend of mine who pushed me along. So I think it sounds like similar experiences. So I'm curious then, how long did it take you from you had the initial idea to the release of the first episode?
It didn't take long because as soon as I left the 4-week rotation with Dr. Houston at the Air Force Base, Dr. Houston agreed to do like an episode with me about, I think it was like a month later. So we released the first episode in February. So it didn't take too long. But I would say the hardest part was getting the voice to sound clear
Hmm.
because
Yeah.
I struggled with it in the beginning.
Yeah, for sure. I still do at times. We're
Yeah,
both,
sometimes it was a little scratchy, but I use this website now from your, like, mentorship and help, like, to use, like, a studio level voice for editing.
oh, yeah. Yeah, there's a lot
Yeah.
of, it's interesting. There's so many resources for podcasts out there now that it's
Yeah.
much easier, I think. So from your episode so far, what do you think have been some of the most useful lessons or maybe pieces of information from the podcast guests that you could apply to a career in pathology?
I would say that Dr. Houston and Dr. Nelson.
Mm.
Dr. Houston, he said during an episode that he loves pathology because of the quiet thinking time, and I really agree with that. I think that I do best in this type of setting, and although I love patients and people and I'm very extroverted, I want to be more of a diagnostician who works behind the scenes to support patients. And Dr. Nelson mentioned that in pathology, it's important to have a good demeanor, and that also really resonates with me. Both of their advices are so helpful when I'm in the fellowship program, and I always remind myself of it.
Yeah, I remember Dr. Nelson said something about making connections or sort of networking with doctors
Yes.
and other specialties, right? People that you're going to interact with, which I think is
Yes.
super important.
Yeah, he also had mentioned that. There's honestly, like, so many that it would take hours and hours for me to share, but
Yeah,
yeah, like, having a good demeanor, good networking, it's that quiet thinking time, focus time, all of these just really, like, they pop up in my head time to.
yeah, yeah. I've found that too. I mean, pathology is so varied that there's lessons you can get from a lot of different people in a lot of different areas of the lab. So that's That's why I keep doing what I'm doing.
Yeah.
So for me, aside from like the professional lessons, there's been a lot of like personal benefits to hosting a podcast. Things like improved conversational skills or getting better at talking to strangers, which I was horrible at when I started. Have you noticed these things for yourself too? What other personal benefits have you had?
Yes, I've noticed that I'm able to better gather my thoughts, make connections. It's a small world actually, and a lot of guests know each other, which
Yeah.
always really surprises me. And it's really nice to see that too. I bump into some of them at conferences, and I think that, just being able to better gather your thoughts, network with other people, and make the pathology community stronger. I would say that. And also, it's also kind of like interview prep for me in a way because I'll be applying to pathology residency next year in September, and I feel like this probably helps vocalize my
Yeah.
thoughts and opinions.
Yeah, for sure. And not only the connections you're making with the people you're talking to, but just you can kind of relay their stories during
Yeah,
your interviews and things. I think that would be super helpful.
and there's a lot of lessons you learn too, like, every episode as we talked about, like, there's always something interesting that I
Mm,
learn or something that I take with me, and it will pop up in my head during certain times during the fellowship, and
yeah.
it keeps me motivated, keeps me going, keeps me inspired.
Yeah. I have that a lot. I go to work and something will be happening and it reminds me of some
Yeah,
conversation. Yeah.
exactly, exactly, and it's like, "Hey, you know what? This is what so and so said, and I'm gonna I got this, and I'm gonna do great. Today's gonna be a good day." So, that's how I kind of uplift myself too.
Yeah. I love that. I get that kind of inspirational aspect from it too, for sure.
Yeah.
Okay. So then the last question I want to ask you, what's next for you on your journey to pathology? Like, I guess, medium or long-term goals then.
I would say as of now to explore as many fields as I can during this year.
Okay.
I know I mentioned like bone and soft tissue and bone marrow or heme path. I still want to explore like derm and molecular and transfusion, see different sides of path and really narrow down my interest end of the year because as we discussed earlier, we have to know by the second year of our residency what we want to specialize in. And I just kind of want to have like an idea at the end of the year.
Yeah.
I tend to love a lot of stuff. I wish I could specialize in everything, but I don't think I would ever retire. I would also in terms of, like, long-term goals, I'd love to stay in California or the West Coast. It's home to me, my family's here,
Hmm.
I grew up here, and I really hope to serve this community long term so I'm able to train here and give back to the area I grew up. I think that would mean a lot. But also, I'm really just thankful for any opportunity to do a pathology residency. But yeah, that's what I would say so far.
Okay. Okay. I like it. It sounds like you're well on your way and you're getting very well prepared to continue this journey. So I love it.
Yeah, I'm very thankful for all of my mentors at the program, all of the speakers, and everyone who gives great advice. It really helps, and I will carry on that advice with me as I go through my training every day.
That's great. That's great. I love that. Okay, Taranjit, this has been a super interesting conversation. I'm glad we were able to do this finally, and I could return the favor for being on your podcast,
Oh, of
which I
course, and
enjoyed.
it's such an honor to be on your podcast. Thank you so much. I appreciate you taking the time to do
Yeah.
this.
All right, Taranjit Kaur, thank you very much.
Thank you.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. Phoebe Hammer as we talk about her experience in a pathology post-sophomore fellowship.
People ask me that all the time and they say, oh, I could have never done that. Training is such a long experience. If you want to be a doctor, you've got 4 years of medical school, and then you've got 3 to 9 years of residency, depending on what you do. And then you have fellowships, and then you're an attending and you get to do what you want to do. And I don't really feel that way. I think that I am doing what I want to do. Like, as a pathology student fellow, I was getting paid. Well, it was more of a stipend, really. But I was just excited to have a job in healthcare, in medicine. I didn't feel like it was stalling my future. I felt like I was just going to work every day and doing something that I wanted to do.
You can hear more from Dr. Phoebe Hammer in episode 92. All right, so big thanks to Taranjit Kaur. What a great conversation and what an amazing journey she's already had in the world of pathology so far. One of the themes that stood out today was how personal experiences can shape the direction of someone's career. And in Taranjit's case, that influence began early. Translating medical information for her mother didn't just introduce her to healthcare, it sparked a fascination with understanding disease, with the science behind medicine, and with the ability to help others by simply explaining information clearly. Her early exposure to pathology was unexpected, watching frozen sections being performed during a surgical rotation as a volunteer. That moment opened a door into the behind-the-scenes world of pathology. She realized that pathology isn't just a supporting specialty, it quietly guides critical clinical decisions. But the pivotal point in her story came years later. Many of us in pathology know the weight that patients and families carry while waiting for results. Taranjit lived that experience from the other side, refreshing the MyChart page, listening for the notification, and then translating the results. It was a realization that pathology provides answers when families are at their most vulnerable. That moment made everything clear for her. It was the moment she knew she wanted to become a pathologist. Now, through her post-junior fellowship at UCLA, she's stepping directly into the daily work of pathology. As she said, this isn't just shadowing. She's grossing specimens, ordering stains, reviewing slides alongside residents, forming preliminary diagnoses, and learning the work from start to finish. And you could hear how much she loves it, especially the hands-on anatomy and problem-solving that comes with grossing. She emphasized something that every PA and pathologist knows well. A well-grossed case sets the tone for everything that follows. She had exposure to a wide range of subspecialties already. Bone marrow, cytology, GI, breast, microbiology, bone and soft tissue, and now autopsy, which she called grossing times 100. And I love that analogy. What I appreciated is how open-minded she is. While hematopathology has sparked her interest, she's intentionally giving herself space during this year to discover what resonates most before eventually choosing a specialty in residency. We also talked about her podcast, Grossly Speaking, which began in an unexpected but very relatable way. She enjoyed pathology so much that she wanted a way to keep talking about it. That sounds familiar? She soon launched the show. What she's gained from this experience goes far beyond interviewing skills. She's built connections, strengthened her confidence, learned to think on her feet, and even found it to be great improv training for future residency interviews. Taranjit's story is a reminder of why so many of us are drawn to pathology. Quietly, behind the scenes, we help patients and families understand what's happening at some of the most critical moments in their lives. Her journey demonstrates that perfectly. I'm excited to see how her journey continues. And hey, if you're not already listening to Grossly Speaking, what are you doing? You're listening to a podcast right now, so you don't have an excuse. Once you finish listening to this, there's only a minute or two left, and go right over to Grossly Speaking, and you can check it out. It's really great. As a matter of fact, I'll include links to Grossly Speaking in the show notes for this episode. Don't forget, you can follow this show at People of Path on both Instagram and Twitter, or you can just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.